Thank you very much, Hans. And thank you very much to Hans and to Alejandro for inviting me to come and visit beautiful Iowa. I was very unhappy that I couldn't make it for the center meeting, but I heard excellent things. Everybody was very impressed. In fact, I was actually, as we're hosting it next year, quite annoyed at how well you guys did. Now, let me see if I understand how this is going to work. My research associate was ridiculously happy with my choice of title. She thought this was very clever, so I hope you catch the reference, especially for a guy that travels as much as I do. I'm in the Department of Pediatrics. I'm a PhD in a very clinical department, which makes me very rare and very special. Having jumped from psychology to behavioral neuroscience to pharmacology and therapeutics to then stem cell research has meant that I've covered a lot of research levels of analyses, which has put me in great stead to run an integrative health science facility core. As I was happily discussing with Brandy earlier, being able to talk to the community groups as well as the people that do the proteomics and vice versa is very important to our centers, and one that we take very seriously at Cures in Detroit. As was mentioned by Hans, I'm also Editor-in-Chief of Stem Cells and Development, Executive Editor of Nucleic Acid Therapeutics, and mostly because of Stem Cells and Development, I'm also the Ethics Advisor for Mary Ann Liebert Publishing. Briefly, what that means, if there's something goes wrong on one of the journals, even if it's the Journal of Aerosol and whatever, I'm called in to deal with the problems. Okay, so that's my disclosures. How many people have seen this figure before? Oh wow, you guys are well ahead of the curve. I showed it last time. You showed it last time. Okay, so my talk is finished. Have a nice day. Thanks for coming. I actually have a copy of this in my office, printed at a massive scale. We're taking it very seriously. When I say we're taking it very seriously, I'm taking it very seriously. The rest of the program will be taking it seriously over the next few months as we roll out a better understanding of how to use it. I'm going to tell you some stories. As the poor people that I've been spending time with since I arrived here know, I love to tell stories. And frankly, I'm pretty good at it. But what I'm going to try and do is tell you those stories, but then try and relate it to this massive, complicated diagram. I'm going to tell you about 3 of the health issues that we deal in Detroit, some of which will resonate with you, some of which will seem a little bit distant, but hopefully you'll understand the problems and you'll understand what the value added we've brought to dealing with those situations in Detroit. I understand I've got 45 minutes to talk, but with quite a bit of leeway, but I'm going to try and hit that 45 minutes, okay? Can everybody hear me at the back? Thank you very much. It's so they can record me for posterity. They can tell their children, their grandchildren. Firstly, can you see in this image? Does anybody know, A, what's in the image, and B, where it is? Has anybody crossed the Ambassador Bridge into Detroit from Canada? This big building is what you see. It's the old railway station hotel. It's a fabulous building, and it's basically just been left to decay. In the front of that building, I'm not sure, is it clear, Alejandro? Can you see what those are? Those are pet coke piles, and they are humongous. And the dust from those pet coke, anybody here, hands up, who knows already about the story I'm going to briefly tell you today? Does anybody know the story? Pet coke. Okay. I'm going to read this because, as I've also been discussing today, I don't want to get sued. In November of 2012, the Marathon Petroleum Corporation's Detroit refinery completed a $2.2 billion upgrade, which allowed it to process up to 80,000 barrels per day of heavy crude transported via the Enbridge pipeline from Alberta. Up to 30% of a barrel of heavy crude is removed as a solid carbonaceous byproduct called petroleum coke, pet coke. What do you think the effect of having over 40-meter piles of pet coke on the waterfront of Detroit does to the locality? Anybody? If you were taking your drinking water from the Detroit River, it's already tainted.
Fish and wildlife affects them.
Fish and wildlife, you've got a lot of airborne particles. A lot of laundry getting ruined, a lot of cars being dusty every morning. March 2013, news reports start to appear as people start to complain. What does Cures do about this? Well, Cures correctly have identified a human problem, and we used what we always use best to engineer research change, our pilot project program. Now, briefly, you guys must have a pilot project program. Ours works through requests for application twice a year. You can get up to about $80,000 over a period of 18 months to pursue a research question. When I first came on board, those applications, they could be pretty rough. Basically, what people were doing were taking failed RO3 applications and throwing them in to try and get some money. What we had to very quickly to do was to educate our researchers and the research community of Wayne State University and Henry Ford that that was not going to work. That was not going to bring you any money. You had to pursue something that was relevant to Cures targets and do it in a way that we felt was sustainable and would attract further external funding. So, I'm not sure exactly how your mechanism works, but ours insists on a letter of intent, and once someone submits a letter of intent, they then have to meet with two groups. Can anybody guess which two groups they have to meet with before they can apply? Community engagement and the Integrative Health Science Facility Corps. If they don't meet with those two groups, they don't get to apply. And we think that's very important. We think this is what is going to drive our sustained ability to do good, relevant research in Cures. We basically use that as an opportunity to build teams. So when they come and meet with us, we will gently suggest to them what we think would A, improve the research project, B, help them identify possible community partners, and C, what other resources they could be availing themselves of, whether it be of people or techniques that we know exist, in order to make a more successful application. I will tell you with no shame whatsoever, the quality of our applications for pilot projects has increased exponentially over the last 2 years while we've been aggressively pursuing these policies. What's also completely obvious is those people that then go away and take our suggestions and then make their application succeed. And those people that have the meetings, because they have to have the meetings, and then bang in the same application they were going to do anyway, don't get funded. And that's not me being spiteful, because we're not the ones that actually review them. We use external reviewers for our pilot projects. Do you use external reviewers? Or do you use internal? Right. You might want to consider using maybe even just one external reviewer. Basically helps with issues of conflicts of interest. We've partnered up with 2 other P30s, and we basically review each other. It really speaks, as I was saying to somebody earlier, yeah, this talk's going to go at least 2 hours. I come from a British neuroscience background. And in British neuroscience, it's not enough for me to be right. You have to be wrong, and I have to demonstrate that as well. And my first centers meeting was Emory. And I couldn't believe it in that room how collaborative people were from the different centers and how supportive everybody was and open with information. I was blown away by it. As people that presumably are competing for the same piles of money, I was completely impressed and totally bought in to the whole research project. I basically shifted gears. I spend all my time now on NIEHS Cures. I'm even starting to tear up even talking about it. I was so impressed. So we take the pilot project very seriously. As far as I'm concerned, the pilot project is is the engine that drives Cures Detroit. That's what allows us to be responsive to local health needs. That's our ability to drive our funding so that we can demonstrate that it's important that NIHS has a P30 in Detroit. Okay, politics over. Politics just beginning. The pilot project group that we put together did what I say is translational research, identifying, once we've identified that concern, the team was built to research the environmental human health impact of that pollution. Now, everybody knows there's a real problem of asthma in Detroit. Can we immediately tie an increase in asthma to those pet coke piles? No, we cannot. There's another big issue that I'll get to that we can tie more directly to it. But what the Cures investigators will be able to show is that exposure to pet coke at the levels that people would have been inhaling do have effect on lung cultures, showing a fibrotic response. And in terms of the NIHS model, we think that's a very nice description of how an observation has been made, and that's then been translated into an in vitro experiment that increases our understanding. Now, something else happened because of that is actually a translation to real local policy, and that we're very proud of. In 2017, the Cures Community Engagement Team, in partnership with the Great Lakes Environmental Law Center, anybody here met Nick Schreck? Nick Schreck is one of our community engagement guys. He's huge. He's very impressive. He's very nice. He's very collaborative. If you haven't met Nick Schreck, get in touch with me. I'll put you in touch with him. They used the research that we developed at Cures to inform the passing of a new policy to enact the Detroit Bulk Storage Ordinance, requiring that carbonaceous bulk solid materials such as pet coke be kept in contained storage facilities. Now, is that what happened to the pet coke? No. It was shipped to Chicago, where it was stored in exactly the same way as it was stored in Detroit, awaiting then shipment to Asia. But it was a win for Detroit, and I don't mean it was a win just at the expense of Chicago. It was a win in terms of policy change occurred, and Cures research was instrumental in driving that. Either way, anytime anybody's got a question or a comment while I'm rattling on, feel free.
Is it flammable, this pet coke?
Yes.
So why not just burn it as a fuel source to generate heat or electricity?
An excellent point. We do not have the need or the efficiency to do that to make it worthwhile, whereas in Southeast Asia they do. And that's where it's headed.
So that is the purpose in Southeast Asia to use it as fuel.
Yep. We like the network, but we think there's a big piece that's missing from that outer ring, and this is what we think it is, which is community empowerment, which we really take very, very seriously in Detroit. If you're not empowering the community to be informed about environmental health issues in a way that allows them to change behavior, you're wasting your time, in my mind. And so I think this is something that should actually be added to the model. So shortly after passing the bulk storage ordinance, Marathon Oil Refinery applied for a waiver to avoid containing their pet coke piles, citing high costs despite record profits in 2017. A better informed community, now with strong ties to the community backers and scientific evidence and their representatives, fought back, and Detroit denied Marathon's request for open-air pet coke storage. And the city council did actually cite the community response as part of their decision. Now up to a higher level, the U.S. Senators Gary Peters, Dick Durbin, with Reps Rashida Tlaib and Robin Kelly teamed up on a bill to pass the Petroleum Coke Transparency and Public Health Act of 2019 that would require the federal government to study the potential health risks and environmental impacts posed by petroleum coke exposure. So hopefully this is going to work. What you have there is identification of a health problem, understanding the effects at the human population level and testing through in vitro testing, achieving a change in policy, changes in environmental exposures, hopefully changes in population outcomes, and what we'd like to add, changes in community empowerment. Because we truly believe that the next time an issue comes along, the people that were involved in that issue will feel ready and encouraged to go again and to look to us for our informational support and the secondary policy change at the higher level.
Can I ask a question about
Yes.
So marathon is
Yeah.
so how much, because always it has to do with the power that these companies have in the place that you're doing your research.
Right.
How much marathon has really political and clout in Michigan compared to another company, compared to Ford, let's say?
Compared to Ford, nothing. But politically, a lot, simply because of employment issues and the sort of financial issues that occur in major American cities like Detroit that hopefully are going away, but for a long time certainly did exist. If you notice, I'm standing still while tap dancing wildly here. So politically, yeah, that's
The reason is that we have talked about areas specifically, for example, for Iowa. But
Right.
there are certain areas that are so sensitive in the ability to be able to do this.
right.
That really, I love the idea of the pilot, but at the same time we have this issue of how much you can really accomplish because of some of the realities on the ground.
Maybe like agribusiness.
For example, the cables.
Oh, yeah.
Yeah.
Good example.
Yeah.
Well, I was having a nice chat with Brandy, who unfortunately she's teaching at the moment, so she couldn't be here. And I was asking about the who they have on their community advisory board, and she raised the interesting issue of having people from the agriculture business in the same room as people that are, obviously advocating for change that is against the interests of the agricultural industry. I think I phrased that correctly. But at the moment, who's missing from your community advisory board is anybody from any level of legislature, which to me is a little surprising and perhaps a missed trick to address what you're saying. Because if you have the sort of presentations we give to our community advisory board, updating them on information from our scientists, and you have people from one side of an issue and from another side of the issue, that's good, but they don't have to listen. But if you add to that the legislature, well, they're certainly going to be listening. And they'll certainly be listening to what the responses are from both sides of the issue. Does that make
Yeah.
it make sense? Okay, good. Tap dancing well so far. You will have heard about the water crisis in Flint, yes? This is such a tragedy. When you have people that are trying to make decisions for a community that have no resources, I mean, they are broke. Has anybody here actually been to Flint? Really? None of you? No, you weren't even interested on the basis of, okay, all right. Okay, hands up how many people have been to Detroit? Hands up how many people have been to Detroit in the last 3 years? It's changed a lot, hasn't it? Yeah, it's changed a lot. Detroit's a really, really lovely city to visit now. When I first moved there, if I was going to a rock concert, I drove to where the concert was, parked my car, basically nearly ran into the venue, afterwards came back to my car, happy to see my car still there, drove home, okay? I don't think that's unrealistic as an assessment of what it was like 20, 25 years ago. Now, it's lovely. I take my 15-year-old daughter to go see John Mayer in concert. I park 3 blocks from the venue. It's totally changed. Flint has not changed. Flint is broke, absolutely stony broke. So when people have to make decisions about what they're doing with their budgets, you have to understand that context behind what seems like a remarkably stupid decision, which was to stop getting their water supplied from Detroit, basically, and making one of the most cataclysmic errors to affect human health in America. Just awful. And then go on TV while people are turning on their taps and brown water is coming out and say that the water's absolutely fine. It's not a health risk. Go ahead and drink the water.
By the way, next year, since the meeting is at the Wayne, you should take us all to Detroit.
Trust me. Trust me, Alejandro. Just look at the pictures. I work at the Children's Hospital of Michigan. It's my great privilege to work there. They're wonderful people, and there's nothing like being on the wards and seeing the kids to keep you focused and motivated at what you do. Dr. Mona Hanna-Attisha was, actually, I think she was a fellow when I first arrived there at Children's. And she was the person that first demonstrated that the kids' blood levels of lead were increasing. Anybody here met Doug Rudin? Doug Rudin's a smart guy. And what Doug published was this very wonderful paper. He'd shown it before in mice. And I think if I'm being fair, I would say he's now implied it in humans. I think that's a fair statement, which is that if you expose one generation to lead, that then has changes which are inherited by the grandchildren. That's terrifying. He's shown it very clearly with mice, using I don't know if in Iowa you have something equivalent. In Michigan we have the blood spot bank. Every kid that's born in Michigan, as long as the parents agree, gets a blood spot, and that gets stored. It's an incredible resource for doing research, especially if you want to do multi-generational research. And especially if you know of an incident that you then want to characterize and you know what the date was. It's very powerful, and Doug uses a lot. But basically what his data imply is that the exposure of grandma to lead correlates with changes in the grandchildren in terms of methylation, which I don't understand, because I've got some knowledge of embryology, and as far as I'm concerned, things should have been reset. But oh well, the data are what the data are. Okay, I know I kind of waffled that, but do we understand the basis of what I said? We're okay? We're all still hanging in there, even at the back? I'm seeing nods. It's good. Great. Something else happened as well. So obviously, if you're a neuroscientist like me, when you think about kids getting exposed to a lot of lead, you get really worried about neurodevelopmental effects. What also happened was an outbreak of Legionnaire's disease, and as I was discussing earlier with a pulmonary colleague, I don't think we've even come close to understanding how bad those data are yet, because I suspect that a lot of the deaths that have occurred in the region have not been correctly A, diagnosed as Legionnaire's disease, and B, tied to the event. But I think it'll be interesting to see what happens. I also can't tell you for sure why the switch of the water supply increased the cases of Legionnaire's disease. There's 2 or 3 ideas I could rattle off now if you're interested as to why it would, but I don't know for sure. One is to do with chlorine levels. One is to do actually with the temperature of the water. It coming from a river rather than a lake means that the water would be warmer. That's more permissive for outbreaks of Legionnaire's. But there are a number of reasons why it could have been. So, again, pilot project, driving research interests to follow up on a population observation, showed that the lead levels in water after the source was switched back to the treated Lake Huron water showed decreased lead levels. Not a great surprise. But what we also saw was a decrease in Legionnaire's disease observed. We also took that further. The CURES investigators formed the Flint Area Community Health and Environmental Partnership to evaluate possible associations between changes in the water system and public health. Expanding on that work, investigators have now started collecting water samples in Detroit area to test for Legionnaire's, funded by the Michigan Department of Health and Human Services. So, what you got there is an observation followed by population organ observations, work that increases our understanding of the effects of lead, also further in vitro testing. Where are we going now? Changes in environmental exposures, hopefully changes in population outcomes, but also we're jumping to another ring of the model, to risk assessment, to now expand our understanding and apply it to Detroit. Actually, I saw the other day, you can now go online on an app in Montreal, fine city, and you can check your address to see what the chances are that you've got lead in your water supply. Things they do in Canada that they won't do in America. Number 3, I was discussing earlier, every morning during the summer on the Canadian radio, they announce what the E. coli levels are at the various beaches and waterfronts around Windsor. They don't do that in the States. I presume for litigation purposes. Talking of water quality, the last project I'm going to briefly discuss because it's very new is done by Tracy Baker, and she's looking at the water in the Detroit River, basically measuring it for things that most certainly shouldn't be there. The ones that blow me away is how many pharmaceuticals are at pretty high concentrations in the water supply. That's terrifying when you think what we now are beginning to understand about the over-medication of human beings, to know that in the water supply you're also being exposed to antibiotics that you don't even know you're being exposed to. Pretty scary. And showing the power of how Cures operates, we had her presenting at our Community Advisory Board meeting. The representative, Senator Debbie Stabenow, was in attendance. She basically almost ran from the room to go and tell Debbie all about it, who then insisted that she wanted to come to the iBio. Who wouldn't want to come to the iBio? It's a beautiful building. But she did. She came and got a tour of the whole facility, was shown all the little zebrafish that Tracy has that she's using to measure the exposures. Actually, Tracy also has a setup down at the water station on Bell Island, where the water is actually cycled through. She has racks of fish right there that are being exposed literally to the water supply, which is a fabulous model. So this resulted in a conversation with Cures members, including our CEC environmental lawyer, the lovely Nick Schreck, and the Senator's team on what legislative changes can be made to improve Michigan's water quality. Cures now serves as a scientific resource on environmental health science for the Senator's office. So that's basically what Tracy's doing is method testing and development. It's already starting to affect policy, if policies have not yet been enacted. As I say, Tracy only joined us, I want to say 2 years ago, but is already generating a lot of excitement with her work. And hopefully that's going to change our levels of community empowerment as people become better informed about what's in their water and start asking questions. So, I'm not even sure how long I've been speaking for. It seems a while, but at the same time it seems kind of short for one of my talks. But I don't see anybody suffering too badly. Obviously I'm talking to you from the perspective of the Integrated Health Science Facility Corps. We take our work very, very seriously. We go to every community event. We go and speak to all of the research groups. We have a hand in the assessment and development of all the pilot projects. And the reason we're doing that is that we truly see our main goal as being the bi-directional conduit between the community and our researchers. And for some reason, you've got pictures of us. My Lord, there's me. And there's Malcolm Cutchin. You should have Malcolm come visit. Malcolm is a environmental geographer. Malcolm did this wonderful project that in my naivety, I didn't think it would work. He gave, what do you call it in America? I don't want to use the wrong phrase because it will be offensive. Senior citizens. Is that okay? Can I say senior citizens? Senior citizens. He gave senior citizens iPhones. And what he had them do was keep a log of where they were going on a daily basis, and was then taking samples from these people. And I thought, there's no way these people are going to do this. Every single person took pictures of wherever they were going on a daily basis and returned the iPhone as well. So he's got this wonderful data set that has this basically a diary that he can absolutely confirm that's where they were, and then connect it to exposures that he took. Have Malcolm come visit. He's a wonderful guy. There's our community engagement call. We're about to jump in a river and do things with the public. And this is our community advisory board events that happen 3 times a year. And yeah, I hope I've managed to convey something of our understanding of the new network, how I think we can explain some of the things we do using the network. Obviously, what I've basically been doing without too much sleight of hand is reverse engineering things that have happened into the network. But I can see us using that network in a proactive way that understands that if we're not reaching that outer ring with what we're doing, then maybe we're not doing something right. And on that note, I will thank you for your kind attention, and we can have a discussion or take questions. Thank you. The nice man in front with a hat.
So, very nice talk, and I think it's as a physician always, we've been talking about translational medicine, our